I'm live. Hi, guys. Welcome to another Saturday Night Live. And I'm just gonna go play some music meanwhile until some people join. But when you come, thanks for joining the live. And we're gonna have a very impactful discussion tonight. We're gonna talk about the impact COVID-19 has had on our livelihood, our mental health, as well as our families. So please join the discussion. As I said, I'm gonna play a little music in the meantime while people join, and I'm going to leave in the comment section the link that you all can come on camera with me or voice and talk. And guys, may I ride and whistle? May I do everything in a one? It's been such a hectic day for me. And while I wait to do a roll call and have people join, I already added the pin if you want to join me on audio or camera. That's right there. As you come, drop an emoji, identify yourself so I know who is with me. And guys, as me say, me I ride and whistle. It has been a long day. I'm gonna sip like a soup meanwhile while you all join. So guys, as you join, please let me know. Hi Amanda. Welcome. How was your day, girl? I hope you had a great day, Amanda. I'm gonna turn on the music just a little bit in case it's a bit too loud. And Amanda, I was saying I'm just going to play a little music. It's just been 2 minutes since I started, and I'm gonna sip on a little bit of soup meanwhile until more people join and we can, have a conversation. Amanda says it was a boring day work. I can't say I would want to talk with you. Mine was pretty interesting. Had some errands to run. I got home like maybe half hour now and settled in, heat my food up. And I'm like, okay, I know 8:30 I'm coming live and I want to be on time. So I'm just gonna see Amanda if more people come on and join. I've given enough notice since yesterday. I sent it out to a few people, so I'm hoping people actually remember and come on and join. So guys, as you join, just leave an emoji, say hello in the comment section so I know that you are here with us and we can begin the conversation. We're going to talk about this and have a good time. And share me out. Share out to your friends, the family, if any small YouTubers join or just any YouTubers in general. Share me out so that other persons can join and we can begin the conversation. All right. So Amanda, other than your day being boring, how was it? What else did you do? What did you have for dinner? I'm having a little soup. I'm really hoping that we can get the conversation going as soon as possible. I just had a sandwich. What kind of sandwich, Amanda? Oh, by the way, are you gonna be able to join me on audio or you're still having an issue? Thank you so much again for sharing again. Alright, I need another type of song. This is like dance and electric and hip hop kind of stuff. It's a happy mood. Let's try pop. And let's try this. Alright, that's a little bit more like it. So I'm just gonna turn off the camera for like a minute or so, play some music, and hopefully um more people will be able to join. But you know what? I'm just gonna stay on camera because sometimes people might come and they just see the little round thing and they're not fully aware. Okay, you had egg. Alright, egg sandwich. Did you put tomato in it? Cause you know an egg sandwich with tomato is like the best. Or you just had egg alone with the bread and maybe mayo. I really wonder with regards to the live if persons don't have their notifications off or the timing for my live in the night is just off in the sense that people are still busy. It's 8:36 Canadian time, 7:36 Jamaican time. Maybe some people watching news in Jamaica. I don't know. But Amanda, uh, I'm gonna give it until 8:45, and then I'll start. But anything you want to ask me, connect with me, so we can chat until people join. Just let me know. But yeah, may I use the time for go and eat some food. No tomatoes. Okay. Next time you make it, try it with tomatoes. It's really nice. Or aren't you a tomato person? You don't like tomatoes? Mm. Come on, people, join the live. Who else is here? Okay. Amanda, any recommendations for me? Like, what else can I do to get people to come join the live on Saturday? I always send out a notification. It's on my WhatsApp. It's on my Instagram. I posted it on Facebook. I had it on YouTube from yesterday. So people should have gotten their notifications and set the reminder and come. Yeah, I love soup and I love pea soup especially. That's what I'm having right now. And I like a good old manish water. Mm-hmm. You know what? I've never tried a mukbang kind of thing yet. But because eating on camera is kind of weird, I've never yet tried it. But I'm burning time because persons haven't joined yet. And as I said, I was on the road a good while today, so I'm just getting to have my dinner. Mm-hmm. And I have some great news for everybody, but I wonder when they will join. Right, you didn't get the notification until 7 p.m. today. Okay, so it came an hour before. Mm, not an hour before, so it's 7 o'clock, so half hour before. I should try a mukbang. Will you try it with me? If you try it with me, I'll do it. We can go fast food crazy like KFC and Burger King and whatever else, but you're gonna try it with me? We have a deal, Amanda? Amanda, let me know if the music is too loud or you can hear me properly. Well, if people don't join soon, it look like this is gonna be a soup mukbang. Cause me just a eat and cover. Why? You say no, sir. You're not joining that. All right. Will you at least go for lunch with me? No cameras on. And we can do a vlog together. You don't have to eat on camera. Literally, when people rewatch this, they must crack up, you know. Oh, that's the little round dumpling. The one you're making soup that you come like this with. Mm-hmm. Amanda, you have to check your audio. I see you in the studio, but okay, now I get you.
Oh, okay.
Hi. At first, it just said it didn't give me the option to add you yet. So I think the
Oh,
thing was
oh,
whatever.
I didn't know that I have to press the mic icon for it to come on.
Mm-hmm. Because it would be muted.
Oh,
Boy, thank God for you still, you know, because I'm the one who done step on this.
wait, let me see if I can. Let me see if the camera can work. Hold on.
But I don't know what's wrong. Like, am I missing something? Am I doing something wrong? Do I need to change something or do something different?
But you doing everything. I don't know, man. Let me try the camera
Maybe I'm not
because
connecting with the people right. Man, that seems I lost you on audio, and then you're trying the camera thing gone. But I will till you come back. I said 8:45 we would start talking about it. There is like 2 more minutes. Hi, chilling with Ali and Male. Welcome. Chilling with Ali and Male. I'm still here, just waiting for a few people to join. I have Amanda with me, and we were just chatting a little bit. How has your day been? Chilling with Ali and Male. And I'm hungry, so I just said, you know what? I'm going to go and drink my soup. And at 8:45, I'd start talking until more people join. Chilling with Ali and Mali. I also pinned a comment in the live if you wanted to join on audio or camera, you can let me know. But the pin is right there. I just put it on screen, so if you scroll back in the chat, you can check it. Very busy, tired. I had a tiring day too. I had some errands to run. One major thing I needed to get done, I never get it because as me reach the store, it's like they're closed and they wouldn't allow me in. So For that, luckily I have the documents electronically and I can use it, but otherwise I'd get knocked. So, anyways, I'm going to start with this because I like to keep my promise. It's 8:45. So, I'm gonna go ahead and read some information here that I got from the World Health Authority organization and WHO, as we all know it. And the information indicates that a lot has happened in respect of COVID. Amanda, can you hear me?
Yes, I can. Can you hear me?
Yes, I can hear you clearly.
Okay,
Great.
good. I was
Yeah.
trying something, but then it just come off.
Okay. So chilling with Ali and Mali joined us. She said hello. And I'm keeping my promise. It's 8:46. Said 8:45 I'd start talking about the topic until more people join. So I'm gonna get right into it. Even though it's what, three of us so far, we're gonna have a great discussion. We don't need a lot of people. It's great if I get a lot of people on the live stream because it really will help with my watch hours. Because the more people that are active in the live stream, the better it is. And I need to get my watch hours up. Like for the past month, to be honest, I don't know what has been happening. Every day I check, I just lose watch hours. At first, I lost like 200 watch hours one time. Like one day I checked it, and the next day I checked it, it was like 200 left. And then since then, I've been losing at least 2 hours every day. Even if it goes back up, by the next day it drops back down. So I don't know what is happening. And that's one of the aims why I started the live streams on Saturday, not only to connect, well, first and foremost, it's to connect with my subscribers and to get to know people more. Because, you see people in the chat sometimes frequently, but you've never spoken to them. And I think this is a very interactive way to get connected. And also, secondary, it is to help to improve my watch hours. And that would really help. But in any way, chilling with Ali and Mali is asking when was my YouTube anniversary. It was April of this year of 2021. But even at April 2021, chilling with Ali and Mali, my watch hours was still at a good point. So after that year, or within the year, I'm thinking, okay, even if they show watch hours by year, then after April, sorry, in May, June, it should have been reduced, but it wasn't reduced then. It only started getting reduced like around, I'd say August, September, round about that time. So I really don't know what is happening. And because I'm not monetized yet, I cannot contact YouTube directly to find out or get any information. In the feedbacks, I've read other channels saying information like that, but I don't really know what is the reason. Anyways, we're gonna get into the topic, but thanks for being here with me. So I'm gonna start off by reading something here, and it's actually from the communications officer of the World Health Organization. So I'm actually on the site there. And the information indicates that the COVID-19 pandemic has led to a dramatic loss of human life worldwide, and it presents unprecedented challenge to public health and to people's life as well. Food systems, the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of unnourished people, currently estimated at nearly 690 million, could increase to 132 million in the next year or by end of the year. Millions of enterprises faced an existential threat. So that's just reading like the first paragraph. And then the next thing I'm going to say, it says nearly half of the world, nearly half of the world's 3.3 billion global workforce are at risk of losing their livelihoods. And we say livelihoods, we mean people are losing whether they're jobs that somebody they're working for, or whether it's a case where they're an entrepreneur, they have a business, they're losing their lives, their livelihood. So this thing is impacting us. And this is one of the reasons I said, okay, let's talk about it. Let's see how each of us are coping. Let us share how we can help each other, because it's not going anywhere and we're not talking about it to so as to depress ourselves or whatever the case is. That's not it. It's to bring light to the situation and to really look at how it has impacted us. So that's the first paragraph there. There's some other data that I'll get into um soon, but I just want to hear from both you, Amanda, and Chilling with Ali and Mali, whether in the comments over voice, as Amanda is on voice with me. How has it impacted you guys? So, Chilling with Ali and Mali, you can leave it in the comments. Amanda, you can tell me on audio right now. How has the pandemic or COVID-19 affected you the most?
Well, it has affected me like a lot because in the first off, I lost my job, and
Mm-hmm.
then after I got a new job, I realized that everything, because most of the stuff they're being imported into the country, right? And
Mm-hmm.
when you go in the supermarket, everything is really like sky high. So right
Yeah.
now, like in terms of you getting your pay and you paying your bills, so everything is sky high. You JPS now has 10% increase. I think it's 10% increase on their bills since
Yeah.
COVID. So everything is like
Mm-hmm.
really expensive now. You go in the supermarket, stuff that used to cost like last year, stuff that used to cost you when you go and take up something and it's like $3,000, you're paying like double the amount for whatever you take up. So right now it's like
Wow.
really expensive. Like everything is just super expensive. And you know, when you could go out and have fun, you cannot go out and have fun. Like it's just work, home, work, home, work, home. Nowhere for you to say, all right, you know, I'm gonna go and release some stress or something like that.
Yeah.
So you're just stuck in one place. You cannot go anywhere because everywhere is closed off.
That's definitely tough. And job security has become so much of a big issue due to what is happening with the pandemic or COVID-19. Let's just call it short like that. And other persons have been in a similar situation with you where they lose their jobs, because in the interim, even in some industries where you may have been seen as an essential worker, but then company can't afford to keep you on, then a lot of times they let people go. Chilling with Ali and Mali is indicating that she was made redundant at a job where she worked 8 years for. So that's a big thing. And um, at times, these things come out of nowhere and they really have an impact on us and they affect us, um, because nobody knows what happens. Nobody saw this coming. COVID-19 just came out of nowhere and it happened. And while employers have to do what they have to do, at the same time, employees feel the impact. And coming out of this, I think a lot of people now think more about doing other things that they can to make themselves better or be in a better position so as to have other sources of income. And I think this pandemic has shed a lot of light on that, that you can't just depend on one source of income, because if something happens, then it happens and then you have to deal with it. And it's unfortunate too, because a lot of people can't work two jobs or don't have the opportunities to work two jobs. Not everybody is creative, or not everybody can have a side hustle, because people have families too. And there's 24 hours in a day, and you can only stretch yourself so far and no more. So thanks to both of you for sharing on that. And worldwide, a lot of people have been impacted. When you look at the airline industry, a lot of people have lost their jobs. Some have been made redundant. Some persons who have been made redundant, who have been there for years and years, to a certain extent, maybe it has a lesser impact on them because they get a redundant package and they can put aside something and maybe start something else. But when you're not working for a company a long time, or maybe your yearly wages wasn't even that much, so that if you get a redundancy package, it has a big effect. So a lot of people's livelihoods have been affected because of this. Lost a job. For those who haven't lost a job, sorry, reduced hours. For some who haven't had reduced hours, some people had to move to working from home. Working from home is not the most convenient for everyone, because some people have kids at home, and sometimes that time to kind of balance life and ensure that you have that work life balance, it isn't there. Doesn't really happen. So, in respect of livelihoods, it has a lot of impact on people. And I'm gonna read something else from the World Health Organization. It actually says right here that in the COVID-19 crisis, food security, public health, and employment and labor issues, in particularly workers and health and safety, converge, and adhering to workplace health and safety practices in ensuring that people are protected. You look at things like labor rights in certain industries, and in a certain extent, because of what organizations have to do to keep other employees safe, a lot of organizations have mandated that if you're going to come into the workplace, you now have to be fully vaccinated. And this poses a problem for some persons who are not yet ready to take the vaccine. And then you are faced with the fact that I'm not ready, but if I don't, I'm going to lose my job. Chilling with Ali and Mali says, I lost a close friend because of COVID. Yeah, and we're going to get to talking about that shortly, as to how it really affects our family situations. Sorry for your loss, chilling with Ali and Mali. But Amanda, you being in Jamaican workforce, has there been talks with regards to being fully vaccinated, or people will lose their jobs? What's happening in respect of that right now?
I was asked, when I went to work, I was asked if I am vaccinated, and I was like, no one pushed me to do it, but I figured
Mm-hmm.
that, at some point I would have to do it, so I just went and did it on my own.
Okay, guys, I just turned off the camera for a second, but I'm still here. So, so you made the decision on your own, but
Yes.
in respect of a job now, it's a question a lot of them are asking.
Because even right now in CV, they are asking their employees to be vaccinated, and if they're not vaccinated, they either stay at home, who can work from home, and if they decide that they want to be at work, they have to show up like weekly with a PCR test, and you know that expensive. That's like 20 odd thousand for one PCR test. So it just
Yeah,
will turn out to be that, at one point everybody will just leave. You're not gonna have no employee there because not everybody want to get vaccinated.
yeah. And it's a tough decision because you need money to survive. We need money to survive. We need money to do things. And that can be a difficult thing. Like, it's a big choice. And not only that, if you decide to work from home, do companies give some reimbursement for the internet use, or that's just all on you, the
Well,
employee?
some companies do and some companies don't.
Mm. So there's no specific regulation around that.
No.
So it just depends on the employer and what they want to do, pretty much.
Yes, it all depends on the employer. But most of them, they will, well, I think basically because when you're depending on the job, I guess. I think
Yeah.
only some of them, depending on where you're working, some of them provide you with incentive for so like, all right, yeah, pay for your internet, or even not your internet, but pay for your light bill, help pay your light bill, because some of the
Mm-hmm.
companies provide you with the equipments. For example, the call centers, they give you the computers to use, they give you this, they give you that, but you have to come up with the internet. If you don't have the internet, you cannot work from home. So
Mm-hmm.
yeah, they'll give you incentive for like light bill or something like that, but I'm not sure about the internet part. But yeah,
Mm-hmm.
some of them.
Actually, well, I don't know about all companies here, but a company I work for, at a point in time when we were using our own personal internet, they did offer a reimbursement. So they gave us something to actually help with it. So that you understand, we
Mm-hmm.
weren't, say, I would say, put back in a worse off situation than we really were before.
Yeah.
And that was pretty good. And then over time, not all companies can do this, but over time, if you decided to fully work from home, then they were able to give you their internet access, meaning something that they are paying for directly.
Mm-hmm.
So they set it up and you're not paying for it, but they're paying for it fully. So that helps the situation and that's really good. But not all companies can afford to do that. And some employees have to pitch in. To me, it's a meeting of the not the minds, but the hands. You have to work with your employer and your employer has to at the same time work with you because both need they need us, we need them. Especially if we're not financially self sufficient where we can do things on our own. So we definitely need that. Chilling with Ali and Mali says at her workplace, they are saying they are not firing us, but if we don't take the vaccine, we are pushing ourselves away from the workplace. And that's a tough one. It's like you're being put in a box. Your back is being put against the wall because they're saying they're not firing you, But the reality is if you don't take the vaccine, you're pushing yourself away from the workplace. And I'm pretty sure that they're not forcing or enforcing or saying you must go take it to come on the compound. But there's gonna come a time perhaps where they ask to show proof that you're vaccinated. And when you can't show that proof, they're not gonna fire you, but they're just gonna say you can't report to work. And then we all know that there are different policies around you reporting to work. Like if after 3 days or more, in most cases, generally speaking, I'm not speaking to any specific policy of any organization, but generally speaking, most times if you're absent for more than 3 days or so, it's almost like you abandon your job. And I think maybe that's where they're going when you're saying you're pushing yourself out, because the reality of the situation is they're not going to fire you and say, "Oh, we fire you because of that." But chilling with Ali and Mali, here in Canada, in some places, especially in the health sector, they've actually said to employees that until they get vaccinated, they have to go on leave. And more than likely, that leave of absence is without pay. And the reality is, a lot of people can't stay home, just be on leave without pay because bills have to be paid. And even if you have a little money saved up, nobody wants to go into their savings to go take out money every time to help with this and help with that. Money going out and no money coming in is never a good thing. Your resources are gonna get depleted at some point in time, and then it's gonna put you in a difficult situation. So this thing is affecting our livelihoods um a lot, to an extent more than we even know. And we have to make some difficult choices, because sometimes we have to make the choice of, I'm not ready to be vaccinated, but I'm going to do it because I want to secure my job, because I have my kids' school fee to pay. And even though it's online schooling, you still have to pay the school fee. There's no reduction in that either. The school is still asking for their money full force. You still have mortgage to pay, light bill, water bill, internet, all these things to try to keep life going on consistently. Amanda, you mentioned earlier that, sometimes there is no outlet because of what is happening. Life is not as it used to be, where we can go out and do things to de-stress. And sometimes the simple thing of just ensuring you have internet and cable while you're at home to at least watch a movie and laugh, or go on the internet and do something, it's really essential. It's almost as if it's not that we can't do without it, but especially in a situation like this, it's how we stay connected. It's how we are able to connect with our families. It helps us to keep somewhat sane, for want of a better word. And we're going to go into the mental health part of it. But COVID-19 has affected our livelihoods in a lot of ways. People have lost their jobs. People are working reduced hours, and on reduced hours, less pay. Some people are on leave of absence because of the fact that they're not ready yet to take the vaccine. And then it could put them in a position where it's complete loss of job. So I'm going to read one other thing here, and then we're going to move on to talking about how it really affects our mental state of mind. It says here that globally, as of 4:40 p.m. Central Eastern Standard Time, October 29, 2021, there has been 245,373. I don't know if I'm calling the figure right, but it's 245,373 and then 039. I don't know if it's billion or million. I was saying 245,373,000, but then I'm gonna write it in the chat and you guys tell me. It's 245 373 039. Amanda, and chilling with Ali and Mali, I left a comma out, but after the 373, there is a comma. Is that billion or million? Amanda, can you tell? I know
Hold on,
million
just
has up to six. I'm gonna write it again because I left the comma off. So it's 245 comma and then 373 comma and then 039.
it's billion. It's million.
So it's million.
Yeah, 245
5
million
million
373,039.
and 39.
Mm-hmm.
Okay. So it says there has been that amount of cases and it includes 4,979,421 deaths reported to the World Health Organization. And as of today's date, this looks like billion now, 6,838,727,352 vaccine doses have been administered. So the administration of vaccine is pretty high. Um, and but I know that they're still pushing for a lot more people to be vaccinated because it will help to lessen the impact of persons actually, catching it and all that kind of stuff. But this thing is for real. It's not going anywhere for right now because there is different variants that have come up, different things that have happened, and it just keeps going. It affects how we move, how we breathe, how we go about doing things in our everyday life.
Even
Now,
Colleen,
mhm,
even right now, or I'm not sure if it's the other, if any of the other hospitals in Jamaica are doing this, but here in Westmoreland, the Savlamar Public General Hospital right now they are full. When I tell them full, they don't have any other beds. So if I should get sick and I don't have the money to go to doctor, they're going to turn me back because my case is not serious. They're only accepting serious cases. So if you're not dead, they're not going to admit you into the hospital because they are
wow.
full. They don't have any beds available at the Sav Hospital.
Mm. That's a rough one because if you can't reach a doctor, or even if a doctor sees you and it's a case where the doctor can't really help you, imagine you go back to hospital and then what is gonna happen then?
Yeah,
How?
because not it's not everything. For example, it's not everything that is wrong with you. So if you're sick, sometimes you cannot see it
Yeah.
with your eyes. Someone actually have to
Mhm.
see you, so it's not going to look so serious to them, but in reality, the case is really serious. So that too
Yeah.
can cause death and all of that. So it is just getting worse. Then it's not getting any better. It's just getting worse
Yeah.
because the hospital is just filled with COVID patients, and
Yeah.
you understand the need bed. What they're doing now is actually building another part, another addition to the hospital so that they can actually get some more beds to
Like
bring
a
in some more
physical
people.
addition or like
A physical
one of those
addition.
10 things. Okay.
Yeah, they're building another part to the hospital just for that. They
Wow.
actually they have a tent right now, but they're adding on again so that they can have
Mm-hmm.
more because I think I don't know the term they use, but they had to do it with the hospital in Mandeville and the South
Mm-hmm.
Hospital. When we were watching the news, I realized that they had to do it. So I don't remember what
Okay.
they called it, but they just give it a term. I don't remember what it was, but it's really bad down this side
Wow.
as it relates to that.
Chilling with Ali and Mali, I acknowledge you. Thank you. She said she'll be back soon. But that's a tough situation because, like, I mean, suppose somebody has asthma and they have an asthma attack and they need to go in, or it's an emergent situation. Somebody meets in an accident and that's the closest hospital to them. So then what happens? So this thing has a really great impact on us. And It just goes to show that even governmental resources are not able to even respond as well to it because they don't have any beds.
Yeah, because they're saying that they're getting some beds, but you know how it go in Jamaica, everything just slow.
Yeah, it's gonna take time for that to happen. It's a tough one. It's a really tough situation. Here, to be honest, I'm not an avid listener of the news, so I don't know locally. Last time I checked, though, I don't think they've had any situations with being out of beds. There are about two major hospitals close to where I live. But what I know is that they do encourage people do not come to the hospital unless it's an emergency or if it's something that your doctor can't handle, or when we even talk to our doctors now, if it is something they can't handle, then they'll send us to the hospital. But can I tell you, through 2021, between ending of 2020 to 2021, I needed to see the doctor. I have not physically seen the doctor. I have only spoken to the doctor over phone, sent photos, and I've gotten prescriptions. But even that, they were saying the other day that doctors should start doing in-person care again. But I don't know what will happen. But a lot of people have started to call for it because a lot of times it is really hard for a patient to explain what is happening, and then a doctor just go assess over audio and say write a prescription or whatever. I mean, you don't get your lungs listened to anymore. Not they're not looking down your ears or nothing. Like no checks are being made. You're just getting prescription and you hope that when you go and fill it, you'll be okay. And
Yeah,
and that's
because
so.
further up in the year, so I have problem with my sinus, right? And so my sinus like really bother me and like it gets infected. You know, it give you the
Yes.
symptoms like COVID symptoms. I went to the doctor and I him like because I went there before and he treated my sinus. So I went
Mm-hmm.
there and him just assumed say, yes, it's just sinus and him prescribed medicine to me and up until now it's like them no work. Because him never do one third check to say, alright, you know what, let me really check to see what is wrong with her. What is causing
Yeah.
this? Why her throat always sore? Why her tonsils them as swell? Alright, maybe it's tonsillitis. Alright, let me look in her mouth. Let me see what is going on with her tonsils. Nothing like that. I'm just say, alright, it's just sinus and prescribe some medicines.
Oh, whoa. Him just say a sign us because that's the last time. No, and
Yeah,
that's not good enough. Like, I hate when they do that because I'm like, you need to be thorough. It could be something else. And then the thing is, if it's really your sinus and you got medication, why haven't you really gotten better? Why hasn't there been a really proper change?
yeah, so because of that, I was like thinking, and that is the reason because even the other day, I think, I don't know what was wrong. And I was telling myself, I know I'm not going back, I am not going back to him because every time, and like, I don't know, but yeah, like I went there like twice. So the first time it was my sinus. Like, all right, yeah, because I knew that at
Mm-hmm.
that time it was my sinus, but this time I just feel like it was something more than my sinus because my tonsils am swallow, my throat always hurt
Wow.
me, and all of that. And we just said, okay, I treated you for just your sinus back in February. So yeah, the symptoms of the sinus, like
But come on, your tonsils hurt. I mean, it could be tonsillitis. It could be something else. But just to mark it off and say, oh, it's your sinus, I don't think that's good enough. Like, more thorough check needs to be, I think, even he would at least do something to go send you to a lab to do a test, like take a a swab of something and go do a test to check. Look down your throat, look in your ears, do other checks to really see what is happening. Like, why? And that's tough. And you not wanting to go back, I can understand because you feel as if, oh, they're just going to tell you the same thing. And like,
Yeah,
it's tough. Like, and sometimes I realize doctors get annoyed when you start asking them questions. Like they say something to you and you
like
say,
yeah,
don't really believe that is what it is, and they get annoyed and they
yeah,
just
because
make
they're
it and
saying
rush
that.
you out.
Yeah, because they're gonna say,
Yeah.
"Oh, I'm the one with the degree and
Yeah.
XYZ."
But I'm the one with the feelings. I am feeling what is happening with me. I know what is happening with me. So that's a tough one, and I do really hope that this situation improves because I think a lot of people are suffering that way too, in the sense of um I'm not gonna say misdiagnosis, but I don't think people are getting the proper treatment and care that they should for certain issues that they have because of the same situation, because of how the health sector has had to change and the rules and regulations about getting care. It is definitely a tough one. And this is going to lead me into going into things like this affect our mental health, especially when we wonder what is it that is really wrong with me? Could it be something else? Could it even be COVID? But the fact of the matter is, if you never had any other symptoms like you lost taste, all them kind of other ones, then I guess you rule it out. But I've heard of cases where people have had COVID and had no clue. They never know they had it until when a test was done because they didn't show any signs or any symptoms. So it's tricky. I'm gonna read something here about the mental health challenges of COVID. Unsurprisingly, the pandemic has triggered a wave of mental health issues. No lie, this is real. Before COVID, we all maybe had things that happened in our lives that affected us, had an impact upon us, and maybe affect our mental state. But this situation, which seems not to be going anywhere anytime soon, we've been in it for 2 years. It has caused a big wave and it's affecting more people. Whether it's managing addiction, depression, social isolation, or just in general stress that result from COVID-19, we all feel it. And the information I'm getting here or I'm reading is an article from Cleveland Clinic, and it's an article Health Essentials, and it's talking about here's how the COVID coronavirus or pandemic has changed our lives. So it's giving some information about the mental challenges. And this is serious because social isolation, let us talk about that one. A lot of people don't know how to deal and react with this because take a person for example who like being outdoors. You like going out, you like doing things, going to places. It is something that you do that you love. You are interested in, seeing things, exploring. And imagine when we have these lockdown situations, no movement, you can't socialize, you're just home. Every day you get up, it's the same thing: work, eat, work, repeat. It can have a really big impact on people, and some people can't cope.
True.
Yes, some
Even
people can't cope.
because I don't normally go out. I am like a more of an indoor person. But to
Hmm.
show you how like the effect all of this has like really have on me, like right now, because I think about it, mess like me wish like the curfew always could even move up to like 11 o'clock so that persons can actually go out because I would I really like to go out, you understand? And
Yeah.
certain places you cannot go. Certain places are closed off. Certain restaurants are closed off. You cannot go to the river. You can't go to the beach. You can't go anywhere. And
Wow.
that you understand that just yeah, that really take a toll on you because as you said, work, home, work, home, work, home. That is our
Yeah.
routine now. Like we can't go anywhere.
And you know the biggest thing too for people who live alone or single people, nobody else is in the house with you, or you live alone. There could be people around you, yes, but maybe it's you're not family, maybe it's your roommate or you're sharing or whatever. But just whatever situation, people who live alone, all they see is themselves. I love
Hmm.
myself to death enough, definitely, and I know how to enjoy my own company. But every day, no man, every day, in and out the same thing. That can happen. That gets tough. For a while, it's nice, you know. It's nice. You're home. You just watch movies. You eat. You sleep. You get up whatever time you want or whatever the case is. But over time, you need that social interaction. We are made that way. No man is an island. No man stands alone. We need social interaction. We're made with feelings. We need a touch. You understand? We need to have people that we can talk to, do things with, share experiences with. And it can get very, very lonely when you're in isolation for whatever reason, whether you had to travel and you're back in the country and you have to isolate for that, or it's just general isolation altogether because everybody just have a ton of them yard and you can't see your friends, you can't see your family, especially if you don't live in the same household, visiting them and all of that, not possible. And I agree with you. I think in Jamaica they should actually change or extend rather the curfew time. I think it's about 8 p.m. now.
Yeah,
Maybe even.
and I was so happy now that they changed it on Sundays because this lockdown
Mhm.
thing really don't make no sense. So they changed it to 8 p.m. A 8 p.m. curfew, which really don't make no difference because the 8 p.m. as your queen say reach 8 o'clock, you don't get no time to do anything. What happened to those persons who have to go to work? You understand
Yeah,
persons who are going to work and coming in 5 o'clock. As it reach 5 o'clock, everywhere closed because of curfew. So them not get to go anywhere. The only time they
yeah.
get is time to commute to and from work. They don't get any other
Hmm.
time. So it don't really make no difference then.
So it's a tough one because before, what I understood is that it went all the way to Sunday, where Sunday now you were not even able to go anywhere. You're supposed to
Yeah,
stay in
like
until Monday the next day.
you lock right in. Like you have to stay home until Monday. And that is just crazy.
Yeah, that's a rough one. That's rough. And even 8 p.m. 8 p.m. is early, you know? 8
Yeah,
p.m. is very early.
because as your queen said, it's 8 o'clock.
Yeah, that doesn't even afford for any little nightlife, no nothing. That's
Because
just
what
going
they're
about your business to get what you have to get done.
yeah, and what they're saying now is that, for example, if it's just to show how this really don't make sense, right? So it's 8 o'clock curfew. The curfew ends at 5 a.m. in the morning. All right, so
Mm-hmm.
persons have to go to work. You know, you get up in the morning and go to work. Say it's a 9 to 6 job. You leave work, you go to work 9 o'clock. You leave work 6 o'clock. You only have
Yeah.
6 o'clock just right. Just you just get that time like 6 and 7 o'clock to travel.
Mm-hmm.
Some business places close 5, some and most of them have to close 6 because they're saying, all right, some places, some businesses, what Andrew Willis says is that all right, you close 6 o'clock, and some of
Mm-hmm.
them can close just 1 hour before curfew, so 7 o'clock. So
Yeah.
in all with all of that now, for persons who are working, you don't get any time to go anywhere because you just have time to commute to
To
work and
commute.
from, and curfew time now everywhere closed. Say, all right, yeah, time for me
Yeah.
to go curfew because what was happening now, the last Saturday that I went to work, it was 6 o'clock curfew and I leave work.
Mm-hmm.
Let me see. So for example, if I should leave work 5 o'clock, say
Yeah.
me have to rush to say, all right, yeah, me have 1 hour time now. I have just
Okay.
that
So
time period, like just 1 hour to get a taxi and reach home. And you know how it go when it reach certain time when you reach in the wee hours, I can't get no drive to go home.
taxi hard to get.
So yes, so and
So
yeah, it's really hard.
so what happens if you are on the road at 8:30 because you're still in a taxi going home? Do you
If
have to have a
you're
piece of
on,
document to show that you're coming from work or you had
yes,
work?
so the
Like I know
driver,
essential
so
workers.
so if it's your company vehicle, the driver gets a piece of document to say that, hey, that the company gives to you to say, all right, Miss Samuels or Mr. whatever his name want be is to
Mm-hmm.
be is should be permitted or is to be permitted to be on the road for XYZ period of time, whether it's from Monday to Friday, from such time to
Yeah.
such time. So you get that document. So
Okay.
for taxi drivers, no, I think if a taxi driver is coming to pick you up, of course you would have the document. But for them,
Mm-hmm.
no, they are allowed. They're given 1 hour after curfew to go
So
from
by 9 p.m. they have to be off
yeah,
the road.
so by they get 1 hour extra to get from where they are to their home.
Mm-hmm. That's tough. And that's a tough situation to be under. I know here when we had our lockdown, movement was very restricted to a certain extent, but not like how it is in Jamaica, to be honest. And no, we don't have a curfew. We have the freedom to go about and do things, and even some activities are back on stream. As you saw in one of my last videos, I went to Vegan Dale, Vegan Fest for food and music, and quite a bit of people were out. It's mandatory, of course, that you have your mask and so on, but I can understand that that's tough. You can't really go anywhere. You can't do anything with that type of restriction of you have to be off the road by 6 or a certain time. I think at least they should put it to 11 p.m. Because naturally people like being out late. But 10, 11 p.m., come on, extend it a little bit so that after work people can still go and do something. So pretty much it's almost as if you're being told, stay at your yard. It's
Yeah,
like
because
you
and you
just
know what
need
I
to stay
noticed?
home and that's it.
Yeah, and you know what I noticed too? You see, what I noticed is that, and I don't know if the government don't notice that, but I think everyone noticed it. But whenever the tighter the curfew always be, the more cases you get because then you're gonna have more persons crowding. You
Mm-hmm.
understand crowding up in certain places because curfew or a wind down and the need
Yeah.
to go XYZ place. So you have persons a crowd up. For example, on when it was you remember at that time when you hear so Jamaica have the 3 day lockdown. So they always
Yeah.
have like Saturday, Sunday, Monday, or Sunday, Monday, Tuesday. You always have
Mm-hmm.
persons on Saturday a rush. Like you can't like to go from
Yeah.
downtown South to uptown South used to like take us close to an hour. Just go from
Oh my
downtown South
God.
to uptown South would normally take you like 5 minutes. So
Wow.
everywhere crowded, and the tighter the curfew, what I realize is the most cases you get. So I think all he needs to do is to just let we go.
Free
Just
up the
let
thing
we
a
go.
bit
Yeah,
more.
like you like let we go, man, and you will start to changes because the tighter the curfew always be, the more cases you'll get.
It's tough, and the I understand people have to follow rules and principles, and I am for that because we need to do that to help to protect other people and ourselves. But then when it's so restrictive, sometimes people will want to push the button. You understand? And go beyond that restriction. And that's where, as you're saying, sometimes these restrictions they might not work as how they intend because after the 3 days and the next day is free up there, everybody can go road. I've heard that the place just have enough people, like enough
Hmm.
people like fly and bees and everything out there because at time to go up on road again and everybody's just
Yeah.
out. It's
And
like
even when you go,
nobody not stay in
yeah,
when
like it's
there
one
is the day
time,
to go out.
yeah, because it's for that time period, so when it was a 3 day lockdown. So when you go in the supermarket, you cannot get anything in the supermarket. No bread, nothing. Everybody just rush everything. You know how you go with we Jamaicans with a hurricane,
Yeah,
whatever, all when things of them no want, them pull off of the shelf.
them
So
by.
one person, I'll three bread. I don't know what I'm gonna do with so much bread, but I'll three bread, and because of that, you have shortage of
Maybe
stuff
they're
in the
freezing
supermarket.
some.
Yeah, like
Eh.
them pack up and you can't get nothing when I go to the supermarket. The other day I went into Shoppers here and the line long. I tell you, so the line long. Set up another line how
Mm-mm.
long. And yeah, like and them something here happened when time the other day is locked down. So you have the place crowded and I say get more cases and they need to just look at those things and say, all right, we need to give them more time to go around to get
Yeah.
stuff done because we're not getting
Mhm.
enough time to do stuff.
So pretty much all of these things, the regulations and the restrictions at time, they have an impact on us. They are affecting our mental health because we cannot do some of the things that we would want to regularly do to kind of ease off some of the stress. It's not happening. And as you rightly said, if a curfew ends at 8 or even 7 and you finish work at 6, you really only have time to travel home. If you really wanted to stop and get something like treat yourself to something different, like on a Friday evening, typically in my household in Jamaica on a Friday evening, we don't really cook. Maybe sometimes we will
Mm-hmm.
grab something on the road, or yes, if we don't grab something on the road, we'll do like fried dumpling and plantain or something. No rice and them kind
Yeah.
of food. And
Just
sometimes
dry, as we would have said,
even
dry goods.
exactly, even that, some people just want a little break to breathe. Work is done. I don't feel like I just want to rush home because when I rush home, I don't have internet. I probably don't have cable. It's
Mm-hmm.
just me trying to entertain myself by reading a book or something, and a little piece or a little way to ease the stress off where I could just stop and go somewhere to buy a drink, sit down, maybe talk and socialize with somebody. It's not there because of the
Mm-hmm.
restrictions, and it really affects our mental health. And it this whole pandemic has just caused a lot of health issues for people mentally, because some people can't cope with certain things. Some people go into depression. Last week on the live, I was talking about depression can happen to anybody. Um, as happy as somebody can be, things can happen, things can hit, things can happen in your life, and you can become depressed because it can happen to anybody. And here it says from a survey that was done, it says that of those surveyed, 55% of people reported mental health issues since the onset of the pandemic. And 74% of those people are between 18 to 34 years. So these are people within a young age group. And the things that they mentioned: stress, anxiety, depression, loneliness, or isolation. And 33% overall um, had issues with stress in that same 18 to 34 group. And the loneliness and isolation figure was something like 24%. So people are having an impact on their mental health. Some people just don't know how to cope, what to do, because this situation is unlike no other. And I mean, if there are persons that see the live after and join while we're finishing our conversation and talking, if there is something that you are doing that is really helping you to stay mentally fit, share it. Share information in the comment section after the live is finished and you're watching. Let us know how you personally are coping. For me, I think I have coped in the sense that I have filled my life with a lot of things to do. Not on purpose necessarily, but because of things I need to get done in my life. So I commit time to doing my YouTube videos, so that keeps me occupied. I have my job, and there's a second job that I do at times. So sometimes I'm sleeping literally maybe 5 hours a day, and it's not 5 hours straight. Sometimes I'm sleeping maybe 4 hours in the morning, then I work, and then after work, I'm getting an hour or two nap, and then work again. So that helps me mentally because I'm active, I'm always doing something. One of my jobs, I'm home, I'm by myself, but I still have a good team where we chat in between work through our systems. And then the other one, it's in person. So I actually go and see people and talk with them and meet new people and meet friends. But some of us, our lives are not set up like that where we do that. Some of us only have one job. By the time you go home and you take care of necessities like cooking and all of those things, you still have a bit of time to do. So, my suggestion or recommendation to people in general would be that extra time that you have, try to fill it with something, whether you want to learn a new skill, anything. It can be something simple. I mean, you can treat yourself to something, but it's not like every day you are gonna be able to do it. But you have to schedule something. So I'd recommend finding something that you like as a means of interest and put time into doing it, into learning more about it, as well as doing some scheduling of something where on one day you decide to do something, maybe take up a book and read it, or have a night where you just pamper yourself. You fill the tub up with water and you just soak and enjoy yourself. Put on some music, light some candle, and every Tuesday night that is what you do to relax and take care of your mental fitness and your mental health. And that's the only way I think we can respond, because complaining about it not going to help anything. So my thing is to find something that you like doing or something that you're interested in knowing how to do and try to learn that skill, as well as schedule things to do on at least 1 or 2 nights out of the week, something to take care of you. Another thing comes to mind is that perhaps you can try to connect more with your family or your friends that are at a distance, whether do a video call, something. I think that will really help, because if you can't socialize in person, at least seeing the person on video, it kind of helps. What do you think, Amanda?
It really does because well, most of the time I wasn't living with my other sister. So now I'm living with one of my sisters, but before I was not. And you just talking to my sisters like on the phone and like on video call, just seeing them, or just talking to them in general. That really helped. When
Hmm.
you're by yourself, really help with your mental health because you just need somebody to talk to sometimes. And yeah, like that just you would not like having anyone to talk to, just really it really bother you.
Yeah, it can really have an impact. And uh like for me personally, my family is in Jamaica, as you know, and I'm here. I don't get that in-person time to hug, touch them, that kind of stuff. And sometimes it can have an impact, but I start just thinking about the positive. When I talk to them on video call or they share photos with me, sometimes if I'm feeling some sort of way like I'm missing them, I just go back and look at photos, or I look back on video chats, maybe something I screenshot of me and them laughing together or something. And I just keep myself happy by looking forward to the things that I'll be able to do with them when I see them. So this thing affects us, but at the end of the day, we have to try to be as positive as we can. It's not the easiest thing to do, every day, but we have to make that effort for the sake of our own mental health and mental fitness, and to ensure that our state of mind is in a good place. So that's what I would recommend. And even as you mentioned families in the title, we said we would talk about families too, how it has impacted that. And then we're going to wrap up the live. So, pretty much, a lot of families are unable to see each other as they would normally. And that's a tough thing. Whether from a distance or whether in person, because with the onset of COVID-19, if you don't live in the same household, you couldn't just be going back and forth and visiting your families here. There was a restriction on that. You had to stay in your own household. They had to stay in their own. There was no visitation between. But now that things have changed a bit, you can now go and you can now visit, and then there are limitations of minimum, maximum, or maximum that you can have in terms of an outdoor activity or people gathering inside. I don't know in Jamaica if at any point in time was there anything like that where you couldn't visit family in a different household?
Wait, yes, but that was if the person is a senior citizen. So if it's an elderly person, they would
Yeah,
recommend that you don't go around them, seeing that they are more fragile. And let's put it that way, they're fragile, and they will be then it will be easier for them to catch it, and you know, there's a possibility that they might not recover. So they would urge us to not go around elderly persons. If we're
yeah.
visiting them, always sanitize, always wear a mask, and all of that.
Mm.
There was I have an experience like that. I have a sister which she's
Amanda,
really sickly. Yes.
Amanda, just 1 second. I'd like to welcome LVL Vlogs. Welcome. Thanks for joining us. And Amanda, continue talking. I'm just going to come off camera 1 second because my battery is going low. So I'm just going to connect it. But I'm still here. I can hear you. Go ahead.
Okay. Yes. So I have a sister. She's really sickly, and the other day I went to visit her, and when I went there, I had to be wearing a mask because, I
Yeah.
have to protect her and all of that. So, yeah, like, yes, and with that really impacts us, like, mentally. Because first time we used to can go and visit and not be wearing any mask, we can hug and all of that, but no, we cannot do anything like that for persons who are sickly, or persons who are elderly or anything like that. We cannot socialize how we used to, and we don't connect how we used to then. So what we're used to doing is just hugging, and all of that. Now we have to keep our distance. We have to be wearing masks and all of that. So yeah.
It's a tough one. Before I respond to that, LVL Vlogs, welcome to the conversation. As the title suggests, we've been talking about the impact of COVID-19 on our livelihoods, our mental health, and our families. And as you join, let us know in the comments what has the impact been on you. And if you want to also join us on audio, there is a pin in the comment section at the top where you can actually click on to join us. But welcome again. But let us know in the comments definitely how it has impacted you and the people around you. So Amanda, in response to that, I know that's very tough. And imagine um, even other people's situation as well. And when you haven't seen a loved one, even a close friend for a long time, and you can't even embrace them or touch them, it's a serious thing. And take for example, the impact on me personally is that I haven't seen my family in 2 years. September 2019 was the last time I physically touched my mom, my dad, my sister, my nephew, or my niece. And I miss that a lot. And sometimes I feel like I'm missing out. And I'm missing out in the sense that Sometimes I call and they might be eating dinner, or they're just sharing and talking and they're laughing, and I hear my niece saying something in the background, or my dad, and everybody's laughing, and sometimes I feel like I'm missing out. Like I'm the outsider. Like I can't share in all that fun because I'm not there. And then sometimes I think about it and I'm like, um, if I could, I would definitely be home and spend a extended time, or if it when it gets to a certain point in time, spending more time when I go on vacation, or being able to get up and go for a quick
Mm-hmm.
visit. But COVID-19 has put even so many restrictions on travel that picking up and getting up and going isn't as easy. So in 2019, thanks be to God, I went to Jamaica twice, in July and then in September for a wedding. So I had my regular vacation, which was short. It wasn't long, but then I also had a wedding I went back for, and I got to see my family. To tell you how much, at the time my niece was only 5 months. At that time, she didn't know me. She couldn't recognize me. She probably look at me and, oh, you look like my mom, you know? But she couldn't talk. She was still a baby. And now she's 2 years. And I talk to her now over video call or the phone, and she calls me Auntie Call now. And my mom has a photo, one of my graduation photos, somewhere in the house. I think maybe in her room or the living room. And when she passes, she's like, Auntie Cole. So now she knows me in the sense that she can say who I am. But at 5 months, she had no clue about me. And thank God for the family I have, though. They've been able to introduce me in a way where she grows to know me, although I'm not physically there. And I have to be thankful for that. But at the same time, I feel like I've missed out on so many things, memories, like seeing her walk for the first time. You know, those little things. And she's a very intelligent 2 year old. And sometimes when they tell me about things that she's saying, or even when I hear it when I call, I'm like, oh my God, I'm missing out on so much. And if it were possible and the travel restrictions weren't as stringent as they were, then who knows, maybe I'd be traveling more often. But because of the pandemic, though, I did miss my trip in 2020. So I was not able to go. And even 2021, I was still considering, am I going to be able to make it home? Because at one point in time, if you're not vaccinated or anything like that, when you come back to Canada, you have to quarantine a hotel for at least 3 nights, all those kind of things and regulations going on. So it has made traveling more tedious, and
Mm-hmm.
people really think about, I miss my family. I want to see my family, but going through all the different things that you have to do, you have to get tested before you go. Any country that you're going into, you have to go fill out a travel authorization form. The country that you're leaving from, when you leave, you have to show proof that you've done the test, whether PCR or antigen or whatever. And these things cost. And guess what? The individual who wants to travel bears the cost. And that's a tough one. And a lot of us are not in a position where we're making millions of dollars, or we're even earning 1 million a year. Far from it, or even 100,000 or 200,000. So the expense of traveling is much. And as much as we want to see our families, it can be an impactful thing on our finances, like if we just get up and go. But in terms of family, the most impact it has had on me is that the number of times I would have gone and been able to physically see my family, I haven't gotten that chance. So I've had to use audio and video calls and messages and so on to stay connected with them. So it's been a tough one. And I know a lot of other people have these types of experiences, and we can only hope for better and hope that for future this improves. And my hope is that maybe just like that, COVID would just go and things get back to normal. But that's a hope. We don't know. We don't know what's gonna happen.
Well, we all hope that it because we well since today, even today, I was saying to my coworker that boy, I wish I could just take off my mask and just breathe like fresh air instead of just understand having this mask for the entire day. You have to wear it
Yeah.
as you step out and you don't take it off until you reach back home. And suddenly
Yeah.
you have stuff breaking out on your face because it doesn't matter if your mask is clean, you still go have stuff on the mask that you understand that it's
Hmm.
not really good for you, whether it's the regular the blue mask or the cloth one. They are like you understand do stuff to your face. So
Hmm.
yeah, like I just wish I could just take off my mask and just breathe the fresh air like while
Yeah.
I'm at work and not just have on the mask. Because even when you're speaking to people and they're saying like, can you say that again? Like you have to be you understand pulling it down or pulling it up over your mouth so that you understand your words can
We
come
can
out a
hear
little bit
properly.
more. Yeah,
Yeah.
so I just wish I could just not wear the mask anymore.
It's a tough one. So you're saying within your workplace, even when you're at your desk, you still have to have on your mask, or
You
when
have
you move
to,
away?
yeah, you have to have on your mask at all times. So the only time that you're supposed to be out of your mask is when you're at lunch. So when you're eating, that's the only time you should be out of your mask. Other from that, you should have on your mask at all time.
That's tough though, because I thought within the cubicle situation they would put up that plastic thing. There's a word for it. It's like the thick glass thing, because that
Yeah, but I
way
don't.
when you
I,
speak, it's not
that
going
just
out.
divide you. That really just divide you from your neighbor. It's not really doing anything. It's not like you're in like an enclosed place by yourself,
Mm-hmm.
because when you move your chair, if you move your chair, like yeah, you're looking right at your neighbor. You two, like the two of you, you're
Oh,
at the
okay.
same place. So to me, that don't really do anything.
So
It
the
don't really do
cubicles are
anything
not
to me at
really distant
all.
enough for
No.
that to happen. That's a tough
And
one.
yeah, before when the pandemic just when it just hit, it used to have
Mm-hmm.
like um when it just hit before I stopped working, when it just that is when I yeah, so when it just hit well, before I stopped working then yeah. So before I stopped working, what was
Mm-hmm.
happening is that you actually have them spacing you out to say like 6 feet apart. So you would have like one cubicle have someone, the next cubicle is empty, one cubicle have someone, next cubicle is empty, and so it goes for persons behind you or persons in front of you. But that is not what they're doing now. So for every seat, you have one cubicle with someone,
Wow.
another cubicle with someone, another cubicle with someone, and the only thing they have is just this big glass screen, which is not really doing anything. So you still have on the mask
That's
because you
tough.
have persons, yeah, because you have persons coming in and they're checking you. So they check you like say every what was it again? They check you when you come into work, they check your temperature. Then you have someone to show up in the middle of the day, walk around,
Mm-hmm.
look to see if there's anyone breaking the protocol. They come to you if you're at your desk and you don't have any mask to come and they tell you that, final warning, put on your mask or first warning, put on your mask and then they just put down your name.
Wow.
on a piece of paper. So yeah, so you have to have on your mask at all time unless you're having your lunch.
That is a very rough one though, because you're in customer service from what I understand, and to be talking to clients and have to have a mask on, that's a tough one. I think they should have continued as much as possible as they could with the every other cubicle, because that's what most workplaces were doing here, to keep that 2 to 6 feet apart, which allows people when they're talking to have their mask off. But that's tough. I mean, 8 hours of work, you probably get a break of at least 45 minutes to an hour, and
Mm-hmm.
you have to have on a mask during the
Yeah,
rest of the
even
7 or 7.5 hours. That's tough.
and the thing is that what I find is that they are overemploying persons. So they cannot do
Mm.
the um one cubicle have someone next cubicle they don't have someone because they're overemploying. They're employing persons at the same time they don't have anywhere to put them.
To put
So
them.
yeah, so where I was working before I first started working where I'm working now, what was happening is that you have they're employing persons, but at the same time you don't have a desk to sign in. So when I come in the morning, I would have to be standing and waiting for someone to get up. And the next thing is
Wow.
that you don't have when someone gets up, you don't have anyone coming in to say, all right, you know what? X person get up, let me sanitize this area. Nothing like that. You have to be walking around to look for something to say, all right, you know what, let me sanitize my area. Let me sanitize the desk that I'm using. Nothing like
Yeah.
that is being done. And
That means you'd have to walk
yeah,
with your own Lysol wipes
yeah,
or
you have to.
something so you
Yeah,
can
man. So
actually clean.
yes, and you should have someone because they have security guards. But at the same time, yes, and you need to have something even at every desk. Let something be there to
Mm-hmm.
say, all right, when this person come in, let this person sanitize the area or whatever.
Yeah. Or so
You
have
understand?
something on a table in every aisle so that you can
Yeah,
go at the top and spray and wipe down and whatever. But that is definitely a tough one. That's really tough. And I'm happy. I'm happy actually that I get the opportunity to be able to work from home for the most part, because then I would be restricted with the masking too throughout the day, and that's tough. That's 8 hours of your life at work, and then remember commuting, you have to have on the mask too. So
yeah,
the only time you really don't have on a mask is when you're home in your own environment, and that's tough. That's
yeah.
really really
Because
tough.
I was coming down in a taxi and the police stopped the vehicle. The guy was close to his destination, and the police stopped the vehicle and asked like, "Why are you not in the mask?" And he said that I cannot breathe when I'm in it, so I had to remove it. And he
Hmm.
stopped it. Told the driver to let him out and let him walk because he can't breathe. And yeah, the guy had to come out of the taxi because he's not going to put on back the mask because he cannot breathe. And the police still told him to
Oh
get out,
wow,
so he had to get out and walk to where he's going
that's
because he
rough.
decided that he's not going to put on the mask because he can't.
But I mean, in situations like that, exceptions must could be made in respect of if the other passengers are okay and they agreed and are comfortable. You understand? Because it's just
Yeah,
one
because
person's thought.
basically it's just him alone that he's not wearing the mask and the windows are down. So Garrison air is being circulated. It's not like it's just in. It's not like an enclosed area. If it was raining, then and you have the air conditioner on, it's just the one
Yeah,
air being circulated all around the vehicle. That would be different. But the fact that
that's
the windows
different.
are down, you understand, and fresh air is coming into the vehicle, and everyone else is wearing their mask. I think,
Yeah.
yeah,
Or
in
if
those
it's a
cases, an
situation
exception
where
should
he
be
was
made.
coughing or showing signs or something, but if he had it on before and you really felt like he couldn't breathe and needed a little bit of air and said to the the taxi driver, you know what? I'm gonna pull down my mask for a bit, and passengers, I hope it's okay. I think an exception could be made, but I'm not in law
Yeah,
enforcement. I guess
because
they have their regulations and their rules that they have to follow, and that's about it, pretty
yeah,
much.
because sometimes what I would do, because I live in Little London, sometimes, it takes a while for me to get a taxi. So what I would
Yeah.
do is to not just stand and wait on a taxi. I would just walk to the square. So while I'm walking to the
Hmm.
square, I don't wear my mask because it is really hindering me from, like, yes, and I cannot
Yeah.
breathe well and all of that. I'm walking and I just need fresh air. Like,
Yeah.
so what I always do is just remove the mask, walk,
Hmm.
and if I get a taxi, then fine, I put it on and go into the taxi. But
Yeah.
other from that, when I'm out in the public and it's me alone on the road or just a few person on the road, I would just take the mask off and just keep to
Yeah.
my side.
Exactly, and especially if nobody is immediately in front of you or beside you, that's understandable. Here, when I used to go for my walks or run before it started getting cold, I used to do that. I sometimes I'll walk with it just in case, like maybe I have to stop somewhere, but I went out to walk to get fresh air, so I don't have it on. The first time ever when this pandemic hit and I tried going out to run in a mask, it didn't work. I had to stop.
Yeah.
I had to stop and walk the rest of the way because it's not breathable. It's not easy to. You can't get any air in through it, and if you're going at a certain tempo, you need to sometimes push out and inhale fresh air or whatever. So it's tough. This situation has really had an impact on our lives, how we move about, what we do. It has really affected our livelihood. We all have to still be thankful that we have opportunities to still work, whether it is you're finding a way to make money on your own because you're an entrepreneur, you have a skill, maybe you're a hairdresser, maybe you're a barber, maybe you sew, maybe you make things with your hands and you can still keep your livelihood up. But I know even that is affected because persons who aren't working, who still need to get their hair done, they might not be going as frequently as before because, the money isn't there. But we all just have to encourage each other, try to be there for each other, try to help or one another. If we have friends and family around us who have lost a job, check on them, find out how they are doing, find out if they're in need of something. If you go to the supermarket and you have a little extra money and you can buy a pound of rice or something that you think they might need, buy it and,
Hmm.
and, and bring to them. We have to all help each other because we all in this together and we don't know what could happen tomorrow if we're going to be more impacted than somebody else who is impacted now. So it has affected our livelihoods. Some of us have been able to work through it. No issues, no redundancy issues, no termination or anything or leave of absence or layoff. But some persons have really been impacted, have lost their jobs after how many years, and they can't continue to take care of their bills as they used to. Some people have had to gone into their savings, and as it's called savings, yes, is for a rainy day or saving towards something. I think some people are saving towards their houses and they've had to gone in to that other things. Maybe you have a child and you were saving for the child's education and COVID come up and you have to pop into that money and use it to try to help out things because kids are now at home. You have to go to work. They're too young. You can't leave them unattended. Babysitter have to come into the place. So a lot of things have happened So we all need to just try to be there for each other. If your livelihood has not been impacted, you're still working, you're still earning, and you can help somebody, give a helping hand. The simplest thing, you might not think it might have an impact or it can help, but it can help. Even if it's a $500 or $1,000 or something, it can help to do something. Or if you have extra, you can buy and give them tin food stuff, non-perishable things. People can use that. It can help out. Even a pound of rice, I said, or a flour or
True.
something. Whatever you can do, look around your community and look around your friends and your family. Some of us have had personal losses. Earlier, chilling with Ali and Mali was saying that she's lost it's either a friend or a coworker to COVID. And a lot of us have had that situation happen. Reach out to the people, find out how they're doing, and especially when there has been a loss due to COVID, this whole thing of mental health, it gets affected. People get stressed out. And can you imagine? I'm going to say it this way, but can you imagine something as simple as COVID? And I say it that way because something as simple as COVID has taken a person's life, and then we all have to deal with it. Before it was cancer or blood pressure or some other thing or something, but an illness that a lot of us still don't know about or know what it really is. We just know it's a virus and it affects
Mm-hmm.
our lungs and our bodies in certain type of way. And I know if it happens within your family and you lose a loved one to COVID, it hit hard. I've had a very close friend losing her dad to COVID, and it hits hard, sorry, because it's something that it wasn't expected. He had other health issues, but that's not what took him. It was COVID. He contracted
True.
COVID and it killed him. So it
Mm.
really has an impact on our lives and the people around us, our families, and our mental health and awareness. So I'm just gonna say, if you are not impacted financially or as much as somebody else is, try to help someone. Secondly, for your mental health and awareness, find something that you like doing, try to learn a new skill, take time to use that to fill your time. But because with restrictions and you can't go out as much and you're isolated because of it, it has an impact on us. But find something you like doing and invest that little time into it. It will help to keep you focused and it will help to take your mind off the stress and the depression and all the other little things, the anxiety, even over not knowing what the situation really is. So find something. And earlier I was saying to Amanda that even if it is for one night, you schedule time for yourself. You either light some candle and fill up the bathtub and take a nice bubble bath, or it's something simple. Find a movie you want to watch, get a book, read, and to keep socialization going, find a family member or friend or somebody that you can connect with at least once a week on a video call and just talk to them and laugh and chat, even for about foolishness or old time days. I recently was speaking to a customer and he has a farm, Amanda, and I actually asked him, "What do you do on your farm?" And he said he raised kids. Not kids. We need to end the live. So, what is this? He raised pigs. He raised pigs. He raised pigs. So when he said that, I said to him, "Oh, that's nice." When I was small, I remember helping my dad to feed pigs because he had a pig pen, and as little girls on weekends sometimes we used to help him to wash it out. And it was two sides, so you put all the pigs in one side and then you wash out that side, and then
Mm-hmm.
so the man was saying that's good because kids needs to have some form of chores, and I said yes, because they can't just grow up not doing nothing. They need something. And it took me back to my childhood, and it really made me laugh, and it's a fond memory. And it was a chore. It's something I did to help, but it was also fun. So um yeah, connect with people, connect with your friends, your family. Maybe laugh about those old school days when you used to, you know, take off your shoes when rain falling and just walk barefooted.
Mm-hmm.
I don't know if you guys ever had that experience, but
I
I
did
did
it
it
when I was
like
going to primary school. I removed my shoes and walk, and when I almost reach home, I make sure I put it on. But yeah, I used to, I used to do it.
I honestly don't remember if I did put on back mine, but it's like it was fun. And it's funny, because those days you never used to get sick so easy, and them look at something the hard rain. My parents got us raincoats, so you have on your backpack on your bag, and your raincoat cover your head, and
Mm-hmm.
it cover the backpack too, so you're not getting wet. The only thing outside is your feet, because you take off the shoes because
Yeah.
you don't want the shoes wet up too, and you put it in your bag or whatever, and you walk barefoot. And yes, for a little part when rain just starts, the place dirty because the mud. Because in Jamaica, a lot of places have red dirt or dirt
Mm-hmm.
somehow. But when rain fall hard after a while and the rain wash off, you just see the nice clear water and it cool, and you don't walk. And you sing with your friend them, and I laugh and I chat and I go about your business. By the time you know it, you reach home. And yeah, people have to connect and talk about old time stories. It might not be something like that, but those things are fun, and it can help to lighten the mood and make you laugh and just remember how beautiful life can be. It's not always as it is now, and it can give us hope that for future life will get better. Things will get better, and we'll be able to go back out and make more memories with friends and family. And yeah, on that note, I'm going to end, and I'm just gonna say, last but not least, um, take time to take care of yourself, but also cherish your loved ones. This COVID-19 situation has made us realize more and more that today you're here, tomorrow you can be gone, and you can lose someone just like this, the snap of a finger. And when they're gone, you cannot give them the things you would have wanted to when they're gone. So you have
Mm-hmm.
to cherish them now. And even though the COVID-19 situation is negative for the most part in terms of the loss of life and the many things it has done, but there are lessons. There are lessons that it has taught us. And earlier I was saying to you, Amanda, that we have to learn to become self sufficient. We have to find ways to ensure that we can take care of ourselves. So if we can't have a job with an employer, we have to use the innate skills that we have, whatever it is, to try to make ourselves financially stable. It's not always the easiest thing, it takes time, but use this time wisely. Um, Try to become self sufficient, try to learn a new skill, do something, and cherish your loved ones, your friends who are not only friends, but they become like your brothers and your sisters. Sometimes they say blood thicker than water. So Amanda, blood is thicker than
Yeah.
water.
Blood
But
thicker than water.
they also say too, friend better than pocket money. And
Yes.
it's true because sometimes you have some friends, man, they really are in your corner. And sometimes, too, it's situations like these that happen globally, worldwide in our lives that show us the people who really are there for us and care for us. Pay attention, people. Pay attention because sometimes some people say they're in your corner, they're not in your corner. But pay attention, love and cherish the people who are in your life. Whatever you can do for them, do it now. And I understand you might be saving for your house, your car, your dream this, your dream that, but spend some money on yourself too, because you don't know if tomorrow you will be here. You understand? You might
True.
leave it, and yes, the other people who you leave it to get to enjoy it, but make sure you enjoy some of it. Don't only work, 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 work. The very Bible tell you say you must enjoy the labor of your own hand. You understand? So whatever you're doing, take time to take care of yourself, cherish your loved ones and your friends, and treat people well, treat people with respect, and look out for somebody else because we're not placed in this earth and this life to just be for ourselves. We're here to help somebody else. Whether you believe it or not, we are here. And that's one of the reasons I did YouTube because I believe I'm here to help somebody. I don't know who it is, but one day, or even already, one of my videos must have had an impact on somebody. Some inspirational video, maybe something I said. Maybe it's just even my tagline of reminding people that your dreams are possible. And guys, not because I haven't shared in depth or in detail one of my dreams that is coming to fruition. You'll hear about it soon. But I think I need to do a story time soon to give
Yeah,
an
you
example.
yeah, you
Yeah, to
need to
give
do a
an
story
example.
time.
Yeah, an example of, one of the things that have come through for me in my life, like one of the dreams I had and I went after and I was able to achieve it. There are still things that I need to achieve, and trust me, sometimes it's hard. Sometimes you come so close, and then you hear that no. But you have to keep going. People may not tell something, me not practice, me I practice it, and sometimes it's very hard, it's very hard to keep going when you keep hearing no. But if you want something, you have to keep going after it because the moment that you stop could be the very moment your breakthrough is coming. And yes, Amanda, on that note with story time, I need to come up with another story time. I've only told one story time in the past more than 1 year. And come to think of it, I was wearing this very same sweatshirt when I did the story time. But yeah, I must do a story time soon. Yes, I definitely will. But Amanda, thanks as always for joining. And I hope to meet you soon one day in person.
Yeah.
Not sure when that will be, but I hope it may be soon. Even if you're not doing no mukbang challenge with me. Yeah, but I hope to meet you soon. And this is one of the things too. I've never met you in person. I don't even know how you started following my channel, if it was recommended or somebody else shared it with you.
I
I
was
don't
just
know.
scrolling. I was just searching some videos on YouTube, and then I came across your channel, and then I just subscribed after I watched the first video. And yeah, I've
Okay.
been. I think it was just you. You just had a few videos then since I think it was last year. Yeah, it was last year, and you just had a
Okay.
few videos, and yeah, I just kept watching until now.
Thank you so much. You've been such a blessing. And yeah, sometimes it takes just one person to make a difference. And you and I, we've shared conversations and so on, but I always publicly thank you for your support. And Maybe I met you through this channel because there is some impact you can have on me and some impact I can have on you. But we are all just not in this life for ourselves. We're there to support other people. And I hope as the journey continues, I'll be able to do much more to impact much more people, and have this community grow and grow and grow and grow, so that it feels a lot like a family, where we can connect and talk and have a conversation and just chill and have some fun too. So on that note, guys, remember, your dreams are possible. I cannot say it enough. You need to believe it. I have more than 100 videos on YouTube, maybe 120 by now. I need to recount and check. So I'm confident I've at least said this to you 100 times. Your dreams are possible. And Amanda, what would you like to say to close out the video?
All right, for anyone who is watching or persons who are going to watch it after the live have ended, like, share, and subscribe to Colleen's channel. She really needs your support.
Thank you so much. And in relation to the topic that we discussed, what would you want to say to people? What would you want them to remember at this point in time?
Just remember that, well, this is not the end of the world. There is still hope. Corona now go be the end. Corona will end. Like, you understand, it must end. Just like color and the rest of it, and other outbreaks, it will end.
Yeah.
Just as Colleen was saying, just, yes, and stay close to family, and keep your mental health in check, and yeah, all of that.
And on that note, we end. Have a great evening, Amanda. See you
You too.
soon. Bye to
All right,
everybody.
bye.
Have a lovely evening. Take care.